And I've always asked, how do you treat, emotional conditions in Thai massage? Nobody has ever come up with an answer. And it's really bizarre that this is an area that Thai massage does not do. Nobody knows how to treat an emotional condition. For instance, let's say one of your parents passed and you had a lot of grief in your body. Can you actually go and receive a Thai massage treatment to help you process and release that grief?
My guest today is the incredible Thai massage teacher, Robert Henderson, and he is going to be answering the question of how you bring energy healing into Thai massage with some hands-on, easy to apply knowledge. And if you are like me, then when I started, I struggled really understanding energy, how to tap into energy, and therefore, for sure, how to help clients who are dealing with all kinds of grief and all kinds of pain and all kinds of issues going on in their body. So I feel it is such a gift to learn from Robert, and that is coming right up.
I'm not the send line person. I'm the energy person, which is very different.
Okay.
Yeah. Although I actually learned, my Thai massage and energy work in Chiang Mai in Thailand. When I was actually exploring energy work, what was organically coming out was not the Thai system. It was actually the Chinese system that I was discovering in my body without being guided in that direction.
Okay.
I got really confused about that, because I thought to myself, because I was expecting that if I'm working with an energy worker teacher in Chiang Mai, as well as studying Thai massage, that the energy lines I should be feeling in my body would be the Thai system, but no, it was the Chinese system. And it's kind of funny because there was a little bit of social media discussion on Facebook recently about, can you treat people emotionally using Thai massage? And it's a question that I've asked, and I can't name any names, it's a question I have asked some really high up people, in Thai massage in America, who, express themselves that they know an awful lot. And I've always asked, how do you treat, emotional conditions in Thai massage? Nobody has ever come up with an answer. And it's really bizarre that this is an area that Thai massage does not do. Nobody knows how to treat an emotional condition. For instance, let's say one of your parents passed and you had a lot of grief in your body. Can you actually go and receive a Thai massage treatment to help you process and release that grief?
Right.
Nobody's come up with an answer. But yet you can go to a Chinese doctor and they will give you needles and it clears.
Mm-hmm.
There isn't the same thing in Thai massage. And that made me realize that, if I'm going to work with people emotionally, I've actually got to start using my massage techniques as a Thai massage treatment, but I'm actually going to connect to the person's body through the Chinese system. So it was this bizarre mix of Chinese medicine, the Chinese meridians, using Thai massage. And of course, some people say that you should never do this. It's a real no-no. So I have to be very careful about, especially about what labels I used to describe the work that I was doing.
Sure. So can you describe for me a little more about what does it mean practically in a session to do that?
What, to work energetically with someone?
Yes. Let's say someone's passed and someone's mother has passed and they're coming to see you and they're that grief. How would you treat them?
Okay. Energetically in this part of your body. Okay. So around the clavicles and the upper breast. So this part of the body here. Oh no, I have to move. This part of your body here between clavicles and breast. This is the area where you store particular energies, emotional energies. One of them is sadness. One of them is grief, and another one is loneliness, and another one is called despair, a state of hopelessness.
Mm-hmm.
So if somebody has a lot of grief, grief has a particular feel or touch in this part of the body. And it's almost like normally when you massage this part of the body, you should be able to, hit the bone straight away, hit the ribs straight away when you press down.
Mm-hmm.
The temperature of the skin should actually be normal body temperature. But sometimes if somebody is holding a lot of grief in this part of the body, when you press down on this part of the body, it feels very, very spongy.
Okay.
Almost like, as if the fascia is about 3 times as thick as it should be. And it's almost like you squeeze down into the body. So there's this little bit of sponginess. And also when you feel the temperature with your fingers or your thumb, it feels cool. It feels, cool to cold.
Okay.
So when you have these characteristics of sponginess in this part of the body and a little bit of cold temperature, you know that you're dealing with, sadness or loneliness or grief. So what you have to do really is just energetically you balance it. So what you do is you balance the cool by using the heat of your hands. It's as simple as that. And sometimes it can be as simple as just laying your hand on the part of the body where it feels cool and allowing the heat from your hand to take the coolness away. And sometimes the response of the client is lying down is you might get a little small tear coming out the side of their eyes, and they might ask for a little tissue to dry their eye.
Okay.
So that's them just releasing a little bit of the grief. And you keep on going until this part feels warm again, and then just gently tapping a little bit to see if it's still spongy or not. And if it's still spongy, then again, you just keep on, either using your hand, straight down pressure, or else you can do like, gentle circular massage, technique. And you keep on going until the sponginess has gone. And then you try and clear the whole area as much as you can towards the armpits.
Okay.
And that's just basically, and again, just check for some tears coming out of your client's eyes. And that's just you helping your client to release grief or sadness. It doesn't necessarily work on any of the energy meridians or anything like that, or any of the Sip-Sen. It's more working on what they call the chakra system. So you have the heart chakra here, and then the area around the heart. So it's I don't like using the word chakras because everybody thinks that that's Indian, but a chakra is a universal thing. It's just that because it's got this Sanskrit name, everybody thinks, oh, it's Indian, it's juju, it's it's black magic or whatever it is. It's not. We all have them. But it just means that you work, the area of the body that you work is defined by the term chakra. So you would work the fourth chakra, or the area of the heart.
Okay.
Without specific reference to a meridian or a Sip-Sen.
Can you talk for a minute about why you think the chakras are universal and why everyone's got them, or what is that? How does that speak to you?
Okay, hang on. I'll just run away and come back again. Okay.
No problem.
Sometimes the answer to the question is you have to set up an exercise for either your student or your massage client for them to feel their own chakras. It's as simple as that.
I think that's a great point.
This is you can't teach people energy work without because first of all, a lot of people are not used to energy, and also energy is invisible, so it's not easy to teach. So what I have to do is I have to organize little exercises for people to do, and one of the exercises I do is I use these things. That's a red one.
Okay.
These are called Tesla plates, and they're just basically metallic plates. That's all they are. I think, the name Tesla could be just an advertising thing or something like that, just a little bit of a gimmick. And what I do is I would get them to lie down on the massage mat, and I would place a plate on an area of their body, which I know to be the location of the chakra. The person who's lying down may not know this. So place like, we have, on the body, we have 6 of these little, chakras. They're basically like little energy wormholes through which energy comes in and out. And I just place one on each of the chakras.
Okay.
And allow the person then to just lie there and just, be with them and say, what's going on? Do you feel anything? And they start feeling very, very subtle things in their body, like it's feeling warm, or it's feeling cold, or it's feeling tight. Especially on the throat. A lot of people have problems with the throat, which is all got to do with speaking and being able to speak from the heart. Okay. And for a lot of people in life, speaking from the heart is very, very difficult. And if you find it difficult to speak from the heart, what happens is that your heart is your heart is trying to push the words out. You're going like, no, I can't say that. If I say that, I'll get into trouble. Right. So you block the energy, you block the rising energy, which causes, depending on if you're afraid to talk, you get inflammation and glandular fever here. If someone is controlling you, if someone is saying, you cannot speak, because if you do speak, like if you have a bad employer, if you do speak, I'll show you the door. So you have a person who's controlling you, and that control will actually make this part of your body go hard. And then it sends up to your lower jaw. So a lot of people, they're not aware that they have this. They have this fear of speaking from their heart, or else somebody is saying to them, no, you can't speak from your heart. So then I place one of these little discs on what they call the fifth chakra, which is the center of communication.
Yeah.
And after a minute, they start going, oh, can you take this away? Because I'm feeling really, I feel really tight here. And that's just showing that the chakra is, i.e. the movement of energy through this part of the body has been strangled.
Right.
And it's also why some people, they are sometimes you can have a dream of being strangled around the neck. Someone is controlling you from speaking, what you should be speaking.
Right.
What I do is I just place these things on each of the chakras, and just see how the person who's lying down, just see what their reactions are. And that gives them the first indication of what a chakra is. And at the beginning, it's just, as I said, it's a very abstract feeling. They can say, I feel tingling, or I feel a little bit of heat. Sometimes, even though the person is lying down, and I place the plate on the front of the body, they feel it on the back of their body, which is what's called the back of the chakra. And some people who, if they are very, very open, if they've been doing yoga or meditation, can feel it going up and down the spine, and they can feel their entire spinal cord going hot, and they can feel the little areas of heat along the spine, along the back, which is the back of the chakra.
Okay.
So a lot of the time I have to allow the person to try and feel in themselves what I am trying to explain, rather than saying, this is a chakra and this is what it does.
Okay.
I try to help people to say, see if you can feel it, and see how it feels to you. Use your own words to describe what you're feeling.